This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Every couple's dream is to have a child. But nowadays, more and more couples encounter problems in conceiving. The World Health Organization defines infertility in women as the inability to conceive after at least 1 year of unprotected intercourse.
So what are the reasons for possible infertility? First, you might not be producing an egg every month. Next, we have to check if your tubes are open or not. Aside from that, we will have to check your uterus itself. Lastly, of course, we will have to check the semen of your husband.
There are several tests available to determine if a woman is suspected to be infertile. A blood test to check hormone levels, endometrial biopsy to check the lining of the uterus, and hysterosalpingography or HSG that involves ultrasound or X-ray of the reproductive system. Tonight, we will discuss what causes infertility, what are the risk factors involved, are there medical breakthroughs to combat this condition, is infertility just a woman's problem? All these and more on MedTalk.
It is the last week of International Month of Women, and for tonight, we will talk about infertility. Joining us is Dr. Edwin Di Mayuga, OB-gynecologist, infertility specialist, and also the chief of the section of reproductive endocrinology and infertility at the Makati Medical Center. He is also associated with the Manila Doctors Hospital, the Asian Hospital, and the Trinity Woman and Child Center. Also with us is Dr. May Sikiang, OB-gynecologist from the Makati Medical Center and the St. Luke's Medical Center. You can participate in the discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Evening.
Tonight we'll be talking about infertility, but we cannot talk about infertility without talking about how does a woman get pregnant. First, let's talk about that.
Well, basically, you should have sexual intercourse an unprotected time, which means that the girl is fertile also, and the man has enough sperm to get the girl pregnant. So basically, that's how you get pregnant.
And normally, there must be an egg which is released from the ovary. This egg, which is released in the process called ovulation, enters the fallopian tubes. And if sexual intercourse occurs at the opportune time, then the sperm and the egg will meet, and now you have a fertilized egg or an embryo, and this embryo travels down into the uterus where it implants and grows as a baby, a fetus, yeah.
Okay, but this is when one will conceive,
Yes.
you know, the possibility of conception. When does it go wrong? When does one deem infertile?
Well, when there's a problem anywhere along those lines, it can be anatomic, it can be physiologic, menstrual irregularities. So anywhere along those lines, if there's a problem, it can cause infertility.
So what is infertility?
Well, infertility is defined as the inability to conceive after 1 year of unprotected intercourse. So that is the strict definition of infertility.
Why is it 1 year? Why given the time frame?
Well, they have done studies on this, and they found out that most couples get pregnant within 1 year. So the majority of couples do. So if you do not get pregnant within that time, then you're considered infertile.
There's such a thing as primary and secondary infertility. Please tell us the difference between
Primary infertility is if you've been together trying to get pregnant, unprotected intercourse for a year, and you're not getting pregnant. Secondary infertility, you did get pregnant before, but now you are unable to conceive. So both primary or secondary infertility warrants investigation. because even if you did get pregnant before, you might have infertility issues later on.
So in other words, primary infertility is a woman who's never gotten
Yes.
pregnant.
Okay.
Secondary is if she has gotten pregnant before and is currently now having difficulty getting pregnant again.
We talk about the difficulty. Is infertility a common problem?
Yes.
Yes, about 12 to 15% of all reproductive age women experience difficulty conceiving. And this is not just in the Philippines. This is a worldwide statistic.
I think one problem is because women now are more career-oriented, so they get married late, and once they get married late, they are so pressured to have a baby.
Right away.
So age is also one factor.
What are the other factors?
Well, there are many factors, but the three main ones are usually in the woman. Women may have ovulatory problems. About 15 to 20% of women with having problems conceiving have ovulatory problems. The second main cause would be structural problems. She may have problems with her fallopian tubes or her uterus, causing inability for the embryo or the fertilized egg to reach the uterus where it's supposed to implant, or because of structural anomalies, if her fallopian tubes are blocked, then naturally the sperm will never be able to meet the egg. And then she may also have tumors in her uterus, like fibroids or myomas. So this can cause problems with the ability of the embryo to implant. And if she has had STIs or sexually transmitted diseases before, then this can cause inflammation and can cause scarring of the fallopian tubes and can cause the tubes to be blocked. And conditions such as endometriosis can also cause scarring of the fallopian tubes. And this can cause immunologic as well as anatomic problems.
We'll talk more about these problems, and we'll also talk about the age in a woman where she's unable to conceive. But first, we will go to our Facebook question. Doctors, is infertility just a woman's problem?
No.
No. The answer is no.
Yes.
A unanimous no. Because infertility, in order to get pregnant, you need a man and a woman. So problems may lie with just one partner or both partners. So you can have a man with sperm problems,
Yes.
which is the most common when the
Yes.
sperm count is low, and other problems as well. So it's not just a woman's problem.
Okay. And Dr. Sikiang, you were our guest
Yes.
before, and we talked about uterine disorders.
Yes.
I go to you now because my next question is, does age affect a woman's ability to have children? And you're here also to share with us
Yes.
your story on how you triumphed and got pregnant.
Yes. So when I got married, I was already 32 years old. So at that time, as I say, you are really pressured to have a baby. So as a doctor also, I have the advantage of treating myself first. So I took all the medications that I feel would help me. I did the test that was presented, the Hysterosalpingogram, after 3 months of getting pregnant, of getting married, because I was really in a hurry to have a baby. But eventually, I had to seek an OBGYN, okay, because I cannot do artificial insemination to myself, okay, and I need somebody at least to help me, because I cannot be very objective. This is myself. So I did 7 artificial inseminations all in all.
7?
Yes, I did laparoscopy also just to check, and my husband's sperm count was also good. So I fall under the unexplained infertility.
Okay.
So eventually we had in vitro fertilization. Luckily, I did it only once, and I had triplets.
It's a success. Wow,
Yes.
triplets.
Yes, I have 2 boys and a girl.
Yes.
How does this happen, doctor, with in vitro fertilization, that you have 3 children right away?
Well, it depends on the number of embryos that are put back into the uterus. The more embryos you put back in, then the higher the chance of multiple pregnancies. Now, going back to your question of age.
Yes,
well,
doctor.
age is a very important issue, a fertility issue with women. Because as a woman ages, the pattern by which she releases an egg, or her ovulatory pattern, becomes abnormal, as well as the quality of eggs that she puts out the quality declines. So as a woman gets older, the chances of getting pregnant become slimmer. Well, usually when a girl is in her mother's womb, she has about 6 to 7 million eggs. And at the time that she is born, her ovaries have about only 1 million eggs left. Wow. And by the time a woman reaches puberty, she has about 300,000 eggs left in her ovaries. And every month that she menstruates, the numbers decline, as well as the quality of these eggs. So this affects her chance. The older she gets, the chances of conceiving decline. Usually we set a cutoff of about, usually after 35, then she starts to have more difficulty getting pregnant, and usually fertility takes a nosedive at age 37.
Yes. So if you're planning to have children at that age, then you really should consult your OBGYN first. Since we're still on the topic of age, what age is the best time? What age is the best time for a woman to conceive?
Well, before 35. Before 35 years of age.
And after 35 years of age, since we're talking about infertility, as your story went, Dr. Sikiang, 32, you were already 32. When did you feel, or when did you decide to seek a second opinion, and you're a doctor yourself?
Well, after around 6 to 8 months of treating myself, then I had to go to because I wanted to have a laparoscopy. Just to check. Laparoscopy is a minimally invasive procedure just to check the uterus. You can really see the uterus. It's not just like radiation, not ultrasound. You can really see the uterus. And we checked my fallopian tubes if it were really open, if it were really patent. So it was patent. And because at that point I was very aggressive. I really want to get pregnant before 35. Because I know very well, after 35, your chances of getting pregnant will decrease, and the quality of the eggs will decrease also. So after 7 artificial inseminations, I just want to have in vitro fertilization. Of course, in vitro fertilization is not 100%, but it will really increase your chance of having a baby. So like in my case, I did it only once, and at least it was successful.
It was successful. We talk about increasing the chances of having a baby. You did IVF.
Yes.
Let's go to our Facebook question. Doctors, does hilot and acupuncture aid in fertility?
Regarding hilot, probably not.
Yes.
These are just folklore. We often hear of patients coming from hilot because they were told that they're mababa ang matris, but there is really no medical basis for that. So regarding the acupuncture, well, that's a controversial issue, but and studies are currently being conducted regarding acupuncture and fertility. But more and more, there are a lot of IVF centers that employ acupuncture as an adjunct to IVF treatment. Usually they do acupuncture on the day of embryo transfer. Well, the rationale for doing acupuncture has not been thoroughly elucidated, but they say it might be because it may increase the blood flow to the uterus. It can cause regularity of ovulation. It can decrease stress and regulate the hormones in general.
But it shouldn't be the only.
No, no, it's an adjunct.
Yes, just an adjunct. So we'll talk about more the causes and the remedies, the medicines and treatments when MedTalk returns.
Did you know that the oldest mother who gave birth was a 66-year-old woman? According to the Guinness Book of World Records, she was Maria del Carmen Bosada Lara of Spain. She received in vitro fertilization treatment and gave birth to twin boys via cesarean section on December 29, 2006.
We're back here on MedTalk, still talking about infertility. Now we will talk about the tests that one should undergo or that the partner should undergo to determine if they can indeed conceive or they need medical assistance.
Well, before we even do the tests, ideally, we should see both husband and wife in our clinics because we have to get a thorough history and as well as physical examination, because from the history alone, then we will know what tests to do. Okay, so for the part of the woman, of course, the most basic would be to find out if her periods are regular. Is she having regular menstrual cycles? Because regular menstrual cycles will indicate that she is probably ovulating regularly. And if she is not menstruating regularly, then we can probably do some hormone tests. And secondly, we have to check her anatomy by physical examination as well as a procedure called an ultrasound. Then we will know if her uterus is normal, if her fallopian tubes are okay, and if her ovaries are okay. Another test that we can do is as was mentioned earlier, is the Hysterosalpingogram. It's an X-ray procedure or sometimes an ultrasound procedure to check if the tubes are blocked.
And these are for the tests
for
that are
women.
done for women. How about for
men?
Men?
The most basic would be the
Sperm
semen
analysis.
analysis. Yeah. Then we find out the number of sperm that he has as well as the quality. So those are the most basic.
It's important that the men are, they're willing to be tested. In our culture, men are like, no, of course not. I don't have any problem. So sometimes what I do, I test the wife first. So if we're okay, now it's your turn. Because usually they're not willing to be tested.
There's an emotional
yes,
battle
which is really
that goes
wrong
on with them, no?
because it takes two to get
It takes
pregnant.
two to get pregnant, yes. And in your case, doctor, did you?
Yeah, I did not
How
have
did
any
it
problem.
happen?
My husband was so willing. So it's not really a macho issue. So please support your wives. You need to have a semen analysis.
Okay. So in support of what you wanted also,
Yes.
how did you deal with it emotionally and physically?
I think Dr. Di Mayuga will agree with me that when you treat couples for infertility, it's not just the medical thing that you do. Sometimes they cry, and I did. It was so frustrating for me. Every month I have my menstruation, and the question would always be, Doc, bakit? But we cannot explain everything. At this point, we can just help you as much as we want, as much as we know. So the role of the husband is very important, because once the wife has her menstruation, she will really cry. And sometimes they will stop treatment because they're so afraid of failure. So what I tell them, you can stop for like a month or two if you're really so depressed, but do not forget, because if you have a problem, it's more difficult for you to get pregnant if you don't address it.
And you addressed this problem 7 times?
Yes, that's why eventually I decided to have in vitro fertilization. Luckily, my husband was agreeable. So the first month, we just had preparation for the in vitro fertilization till the month after we left. So that's how, the most important thing also is the couple. They have to talk how long and how far do they want to go. Because this is also a trials for the couple. So if they have infertility issues, for me, it should make them stronger, not break them as a couple.
Should bond them as a couple.
Yes.
And in their goal
they should be
to have a
able to
family.
deal with this so that it will make them stronger.
So did you get the treatment here, or did you have to leave the country for that?
For the artificial insemination, I had done here, but for the in vitro, I had it done in Taiwan. So luckily, it was okay.
And now they're 8 years old.
They're 8 years old.
Healthy babies.
Yes,
How many girls?
2 boys and 1 girl.
Oh, okay.
So I'm so blessed. That's why I also want to share to my patients that it is not something that you get easily sometimes, but if you get it, once you get it and you really tried hard to get it, you will appreciate it more.
And we appreciate your story very
Thank
much,
you.
Dr. May. We also would like to ask you, doctors, when is enough? When is it enough?
Yes.
When trying to conceive?
Well, that's a very difficult
Yes.
question. Oftentimes we have to really counsel our patients. And some fertility centers abroad usually have psychologists or psychiatrists as part of the team that help the couple. So, but at the end of the day, it's really the decision of the couple, when they will stop treatments.
For me, me and my husband, we discussed it. So we only have 3 artificial. We would want to try 3 in vitro. Then that's it. It depends on the couple. If they're open for adoption, we were open for adoption.
And these are other
yes,
possible
that's what I'm
scenarios.
saying. They have to talk. The communication line has to be open. Hindi pwede yung parang, ay, nahiya ako, I don't want to discuss this. Because at the end of the day, it's the 2 of them that will be together.
Yes, and it's your goal, again, as
Yes,
mentioned
it's your
earlier,
goal.
to be parents and
Yes.
to take care of these children.
Yes.
And it is our goal here on the show to read our Facebook questions. From Maricel Torres of Apalit, Pampanga, I'm already 43 years old. Is IVF still recommended? I'm a regular employee. Can I afford it? How much would it normally cost?
Well, IVF is not for everyone. We have to screen the patients, and based on their history, we will decide if IVF is right for them. In other words, fertility treatment is not a cookie cutter sort of thing. It's not a one size fits all. We tailor the treatment depending on the problems of the patient. Now, basing on her age, I suppose she has been trying for a long time. She didn't mention what problems, what fertility problems she has aside from her age, but she is a candidate already for IVF, because at that age, like I mentioned earlier, it is really, the chances for getting pregnant spontaneously are very low. So IVF would be an option for her. IVF is, of course, it's not cheap, but it is, I would say it is, if you save up for it, then it's worth it. It's affordable. What was the next?
Yes, she was asking, she's a regular employee, and you've answered her question already.
Well,
how much would it cost?
It would probably cost, at her age, probably cost
More
about
expensive.
350 to 500,000.
That's one session. That's
One
the
session,
entire...
yeah.
One cycle.
Yeah, one
of
cycle.
IVF.
Yeah.
One
Because
cycle.
the treatment, the cost of medicines are quite high, and for
And the
the
test.
older the woman is, the more medicines that we would need. So that would add to the cost of IVF.
So it is still possible. I mean,
Yes,
her
it's still
desire to
possible,
have
yes.
children at 43,
Yes.
and it still is.
But of course, we have to be realistic about it. Even if you do IVF at age 43, the chances are not that high.
Not as
it's
high
probably
as
about,
30s.
it's about, at 43, it's about 10 to 15% with IVF.
Okay, but there's
At
still
that
that
age.
15%
Yes,
chance that
yes.
she can
Yes,
still
yes,
conceive.
yes.
Another question from our Twitter page. What is the best time during the normal menstrual cycle to conceive?
That's, well,
Normal
first of
or
all, we're talking about a normal woman who is menstruating regularly. First of all, there is what you call the fertile window, or there's a window of opportunity,
Okay.
wherein if intercourse takes place, then the chance for pregnancy is highest. And usually this occurs around the time of ovulation. Ovulation is the process when the egg is released. So how do you know? And that fertile window is about 5 days, 5 to 6 days, and the best time to get pregnant the peak is about 3 days, ending on the day of ovulation. So how do you know when you're ovulating? First, you have to know what your average cycle length
To
is.
write it down.
Yes,
Yes,
that
so
means
woman have to
you
track
have to
it
keep
down.
track
Track
of your
it down,
menstrual
yes.
cycles every
Yes.
month. Then only then will you find out what your average cycle length is. And like I mentioned earlier, ovulation takes place around mid-cycle. So for example, in a woman with a 28-day cycle,
regular menstruation.
ovulation occurs around day 14. So you would plan to have intercourse about 3 days before that, ending on that day of ovulation, or day 14. And then there are other ways clinical ways to find out if you are fertile or not. One would be a woman has to know her body. Sometimes they can tell if they're ovulating. Usually mid-cycle, they may feel some
pain.
kind of pain.
call that
It's called
mid-cycle
Mittelschmerz. And when the egg is released, there is a pain that they can feel. But of course, not all women feel that. But if you do, then you can record it on what day of the cycle it happens. And then another way would be, you can tell by the cervical mucus that you discharge.
You also have to write that down.
Yes,
Take
usually
every single month.
Usually, fertile mucus is described as slippery. It's like raw egg white. Then you can. That's one of the signs that you are, one of the symptoms that you may be fertile. And usually after ovulation, the cervical mucus becomes pasty and thick, and then you're no longer fertile.
Okay.
Yeah.
So
And then, of course, there are ovulation test kits now on the market, and then you can even go to online and check their calculators for applications
There
for
are
that.
apps for that.
Just track down your
it's a bit-
menstruation.
Getting
There are
pregnant
apps
has
for that.
become high tech
Oh,
now.
wow.
But of course, it
Yes,
cannot
yeah.
replace consultation with that.
Yes.
Of course,
To be
yes. But
sure.
if in the, maybe when you don't have time yet
Yes,
to go
at
to the
least-
doctor,
at
then
least
at
try to
least,
do that,
yeah,
yes.
check your records
Yes.
and
Yes,
do the
so
app
you have to
thing.
keep
Yes.
track of your menstrual periods. Yes.
Okay, and here on the show, we keep track of our Twitter questions. One more Twitter question: when does one need to undergo an infertility test?
Well, if we go by the definition of
Yes.
infertility, if you have not gotten pregnant after 1 year, then it's time to have go see your doctor. But if you are 35 years or
Yes.
older and have not
Don't
gotten pregnant in about 6 months, then don't
Don't
wait
wait.
1 year. And also, if you have infertility factors that you know of, that you, let's say, for example, endometriosis or low sperm, in other words, you already know that you have problems.
Or
Then you
regular
don't-
menstruation.
then if you have
so-
menstrual irregularities, then don't wait 1 year. You can go ahead and
Yes.
seek consult.
How about weight or excessive, maybe smoking or stress or drinking? Does that contribute as well?
Well,
to
weight has
infertility?
always been a factor
yes.
contributing to infertility, and how it's because the excess weight causes your hormones causes a hormonal imbalance, specifically an excess production of insulin, and this causes inability to ovulate. So that's the short answer. And so if you don't ovulate, then there's a decreased chance for getting pregnant.
How about if one is underweight?
Same thing. If
Yes.
you're underweight, if your body mass index is less than 18.5, then it may cause problems with your GnRH release or the hormone release from your hypothalamus, and the result will be that you do not ovulate regularly.
Okay, so these are the factors that can contribute
Yes.
to one being not being
Infertile.
able
To conceive.
to conceive. Yes,
Yeah.
Dr.
Well,
Iván.
you're asking about smoking.
Yes,
Well,
smoking and alcohol
smoking-
intake.
Smoking, the exact mechanism, it can cause infertility, but the exact mechanism by way how it causes infertility has not yet been fully elucidated. But they theorize that it can damage the follicles in the ovaries, and it has been shown that women who smoke reach menopause earlier.
Oh,
Yes,
why is
so-
that, doctor?
Well, because it probably damages the
Is the
follicles, the eggs in her
yes.
ovaries. So they tend to reach menopause earlier.
Okay. And unfortunately, we have reached the end of the show. Maybe we can have both of you come again to talk more about infertility and to help our audience and to those who want to conceive, understand and deal with it more. So thank you very much, Dr. Di Mayuga. Thank you, Dr. Sikyang,
Thank
for
you.
sharing with us your story.
Thank you.
I'd like to again thank Dr. Edwin Di Mayuga for enlightening us about infertility, and to Dr. May Sikyang for sharing with us her personal experiences on infertility. See you again next Tuesday on MedTalk as we welcome summer with fitness and nutrition. 10 p.m. on your scheduled on-air consultation here on the Solar News channel. This is Angel Jacob. Good night.